Greetings, colleagues. I'm Dr. Letitia Rowe, the founder of Click It Clinic, broadcasting live from Houston, Texas, here for our second Telemedicine Town Hall. If you tuned in last time, then you learned the why of telemedicine, why it's so important for we as physicians to be involved and have a leadership role in the changing healthcare industry. Today, I'm here to talk to you about the how. Regulations and reimbursement for telemedicine. Because if this is something you're considering doing, the bottom line is, can you get paid for it? So before we talk about can you get paid, let's talk about how to do telemedicine in a way that is safe for you as a physician and also safe for your patient, most importantly. Recently, just this week, the Texas Medical Board prepared to launch their new rule for telemedicine, requiring physicians in the state of Texas to have a telesite presenter. Many people, patients, HR directors, corporations around the world are wondering why. Why is that necessary, a telesite presenter? Let me present a situation for you. Somewhere in a rural area or somewhere a traveler traveling is wanting to see a doctor online, needs that doctor, needs access right away. Perhaps this person has not seen a doctor in a year or more. Now that individual goes online, perhaps to our site or a competitor, and gets a prescription, treats their common medical problem. A day later, that person dies of a heart attack or stroke. What could we as an industry have done differently to protect that patient? I honestly believe that that is what the Texas Medical Board is doing by requiring a telesite presenter for the first visit and the first visit only. That gives us an opportunity to capture critical information, vital signs, before that patient now has access to virtual visits. I was told in medical school that vital signs are that. They're vital. So learning on the first visit that a person has perhaps uncontrolled blood pressure will give us an opportunity to still treat them virtually. That individual still has access to telemedicine and virtual visits, but now we have the critical information we need to protect them and let them know they need to be seen and treated by a healthcare provider sometime in the near future. So regulations-wise, telemedicine is not going away, but lawmakers are still struggling to find what's the best way for telemedicine to be practiced. I think the Texas Medical Board is onto something, and I wish them the best of luck with getting this regulation pushed through. Unfortunately, just as the law was ready to go into effect, there was a federal injunction placed on this law. So now it's business as usual. You are not right now required to have a face-to-face visit with the patient with a telesite presenter. The patient can just go online and see a doctor with no information beforehand. I believe that face-to-face visits with the physician with a telesite presenter is very important and actually will help us. We have to make sure that in practicing that we practice the correct way. If there are not safeguards put in place as far as telemedicine is concerned, we will have a public health issue. If everyone uses telemedicine and no longer understands the importance of that doctor-physician relationship and going to see their physicians, actually you may have more access to doctors, but you'll have an unhealthier population. And no one wants that. So come on, guys, let's go with the regulations. Let's make sure we, as physicians, are writing letters supporting our medical boards with the understanding that medical boards are there for a reason. We all pay a licensing fee to a medical board to have our physician license. So how can we allow big corporations to strong arm our medical board and shut down the laws that they have put in place? Only for one reason and one reason only, the protection of our patients. So that's an update on telemedicine rules and regulations and what's going on. But let's talk about something more positive in the regulations area. There's actually a physician licensure compact that has currently passed and is well underway. At the last time that I have checked, there is actually 8 states that have already adopted. So what I need you all to do is go online and find out, are you in one of those 8 states? because actually, if you are right now today, you can practice in 7 other states without the need, the hassle, and payment for another medical license. Isn't that awesome? I'm happy to know here in Texas, Texas is actually proposing the law and hopefully soon will be in effect as well. Because as we talk about telemedicine, improving access to care, connecting patients with the best doctors anywhere in the nation, and one day anywhere in the world, we should not have to pay for a license in every single state to do what we do for our patients. So that's underway and coming, and at each telemedicine Town Hall, I'll be sure to give you an update and let you know how many states are currently in the physician licensure compact. So that's it for regulations today. We're going to take a small break and then we're going to come back and talk about billing and reimbursement. Welcome back. So we've talked about regulations and it's time to talk about reimbursement, because the bottom line is if you're doing telemedicine, chances are you want to get paid for your services. The good news is insurance companies are reimbursing for virtual visits. We have had no issues here at Click It Clinic getting insurance companies, when it's an included benefit, to cover the services. So the tricky part is finding out if it's covered. We have lots of tips for you that we can share to all subscribers of our Town Hall series on how you can get reimbursed. What are the codes you need? What are the things you need to look for on an insurance card when you're trying to get reimbursed? Now, what is the reimbursement is probably your next question. So it's anywhere between $35 and $50, which compared to a regular visit is not much less. So it's definitely worth going after the opportunity to collect on your virtual visits. So the next question you probably have is which companies are reimbursing? Unfortunately, I haven't seen good success with Blue Cross Blue Shield, but the best reimbursement is from United Healthcare. United Healthcare has actually said that they'll reimburse at the traditional rate for virtual visits versus just a virtual visit rate. And so you have to make sure that you're looking at each insurance company individually, not just across the board. Now, if you have Medicare and Medicaid patients, Medicaid will actually cover your services like routine insurance companies. However, Medicare, you can only see patients that are in rural areas. Medicare will not cover if the patient is not in an underserved area for healthcare. So it doesn't really matter where you are as a provider, but more importantly, where the patient is. However, where you do stand gained if you're a provider in a rural area is you can get paid not once, but twice. Actually, you'll be paid not only for your physician services, but also for a telesite presenter fee. So for your facility, you will get a facility fee for being a place where a person can receive telemedicine. So if you're in one of those areas and you want help setting that up, please be sure to reach out to us, because for all of the providers in our Click It Clinic network, that is a service that you are automatically entitled to. Now, you are here, you're watching, so you're interested in telemedicine in some capacity. There are 3 ways for you to be involved. You can be an employee. Click It Clinic is currently looking for board certified physicians across the nation. It doesn't matter where you are, we want you. So please, if you're interested, send your resume to info@clickitclinic.com. We are also looking for physician executives. If you have expertise in running a medical practice or expertise in the areas of informatics, human resources, we want you as well. We're looking for physician recruiters. We're looking for our chief informatics officer, and we're looking for our chief mobile healthcare officer. So if you're interested in any of those positions, please be sure to reach out for us. Last but not least, we're looking for investors. So if you're interested in being a physician entrepreneur, you don't want to miss out on the opportunity to visit with us at one of the 10 cities we will be in this summer. And we're going to show you now. If you're in Miami, Dallas, Los Angeles, Detroit, Chicago, Tennessee, Seattle, Philadelphia, New York City, Washington, D.C., or Atlanta, we want to meet you. So look out for the dates that will be emailed to all subscribers of our Telemedicine Town Hall series. So perhaps a friend forwarded you the link. Please be sure to click on the link and become an actual subscriber so that you can hear all the information the cities will be in, when the next town hall series is, our white paper on telemedicine that we will be releasing shortly. We want you to have access to this information, and the only way to do so is to become a part of our Click It Clinic network and our Click It Clinic team. So stay tuned. We have lots of great things coming, and I am so excited to be able to provide you all with the latest in the telemedicine industry and the revolution that's currently underway. Get on board, colleagues. I'm Dr. Letitia Rowe, presenting from Houston, Texas, and this is our second Telemedicine Town Hall. Thanks for joining in.